Let's talk about older silver fillings. If you're in my age group, which is 30 to 60-ish, somewhere around there, chances are you have an older silver filling. Now, they can last a long time, but should they last as long as we allow them to? I'm not going to get into all the controversy of mercury or anything. That's a Google search away for you. Plenty of reading on that. I'm not going to get into that. But older fillings sometimes need to be replaced just because they've been in there too long. Make sure you see your dentist. Make sure you have a good exam, current x-rays, and I'm certainly not going to tell you what to do, but make an informed decision with your clinician. What you're seeing right now are a group of teeth. One tooth has an older silver filling in it, maybe a little bit of blue-gray around it. Pretty standard type restoration. In fact, if you looked in your mouth, you probably have one that looks exactly like this. On the x-ray of this, because of the metal nature of it, we can't see through it at all. We can't see past it because the x-ray basically bounces right off of it. Now the tooth next door to it has decay. It's what we call an interproximal carious lesion. They're hard to see, but that's the reason why when you go into the dentist office, we take all of those x-rays that are going to the side. They're called bite wings, and we're looking for cavities in between your teeth. So I remove the amalgam and I open up the other tooth just so we can evaluate the decay. Now on the smaller tooth, which is a premolar or bicuspid, it's very obvious that there's decay in there. That's that dark staining. Now on the molar, where I just took out the amalgam, you can see that the discoloration is just about the same as the decay. So what happens is, on older fillings, there's not a hermetic seal to this metal, to the tooth structure, and over time, leakage can occur underneath that. Now the problem is, again, when you looked at the x-ray, we can't see that. We can see it when it gets really big and it's getting really bad and maybe even starting to be symptomatic. But on older fillings, let's say 10, 15 years, maybe even longer than that, that leakage does occur. But because the metal filling is basically wedged in there, they can't loosen up, they can't come out. So you're not aware of it. When you come in for your checkup visits, there doesn't seem to be anything going on, but when you take them out, we see this all the time. In fact, I've taken thousands of these things out. I guarantee your dentist has taken thousands of these out, and we all see it every single time. This leakage needs to be cleaned up. It needs to be freshened up, because the last thing I want it to happen is for it to continue into that tooth structure. Look at it this way. If that same leakage was like underneath your fingernail, that'd be gross. You'd go see your doctor about it. You'd have something done about your fingernail. There's something going on. But because it's in your mouth and underneath these fillings that you're not even aware of, you're not going to have anything done because there's no symptoms to it. Now, restoring these two teeth, there's many different ways to do this. You can have another metal filling in there if you like. There's tooth-colored fillings, there's porcelain, ceramic type restorations, but they need to be restored. These two particular teeth, on the smaller tooth, we did a direct filling, which is a tooth-colored filling, and then the one on the molar, we did more of a ceramic-based type restoration. They look good, they look nice, but the most important thing about modern dental materials is that we can see through them on x-rays. So as opposed to the metal-based restorations, which we can't see through on the x-rays, we can see through these. And so if there's any leakage that occurs, we can make a decision a whole lot quicker than before it gets a lot worse. Make sure you talk to your dentist about those old silver fillings.